Hi, I'm Lin.
And I'm Leo. Welcome back to our channel.
Yes, and today we're going to be working on repairing any acute problems with the back. So we're going to be concentrating on abdomen support and strength.
If you haven't already looked at our 3R series, this is the first one that we're doing at the moment, which is lower back problems. And we've already done the relief action, which is when you're in acute problems. This repair is for when your problems have eased a little and you're trying to get back into normal activity.
Yes, and recovering and getting back to regular practice. So we're going to start our practice with Urdhva Prasarita Padasana. So for this you will need to have a belt. If you haven't got a belt, then a dressing gown tie or a tie or even a towel would work for this. It's a supine action, so take a look. Leo's going to lie on the floor and just take a look and see what she's going to do.
You also need a blanket, or if you haven't got a blanket, a folded towel or even a cushion would be fine.
Yes, so those of you who are not practicing yoga on a regular basis, then that's something you do need to consider for the future for maintaining your back and being preventative. So we're going to start with this pose in lying down, supine action. The knees are bent slightly and the abdomen needs to be soft. It needs to be soft so it can be directed towards the spine side. So if you're always gripping your belly, then it's really difficult to move it. It gets really hard and tense. So in this position you have to work at releasing the psoas muscle, literally dropping the abdominal area towards the spine. And then from here you're going to bend your knees into your chest and reach your legs into a straight vertical action, 90 degrees. Now for a lot of you, you will find this really challenging, especially if you practice a lot of sports, hamstrings are tight. This is sometimes what happens. The buttock will lift. Yeah, this is not the good action. Or the legs will be this way. Okay, so how we practice this today is firstly with a belt to see if you can straighten the legs and work on the muscle fibre of the leg. So this way you have to see that you hold on to the belt but you push and direct the thigh bone towards the back of the thigh very strongly. So the top and the bottom of the sacral area is down towards the floor. And be in this position for several moments, practice it several times, perhaps several times a day to build up that strength. For those of you who are familiar with this pose, you can build your strength up and eventually take your arms above your head. If you find it really difficult in terms of, the lower back is lifting, then this is when the blanket comes into hand. So you lift your buttock. It's already lifted. I have to ask Leo to lift hers, so that you have support and stability at the base. Very important. However, if your legs are further away, so they're falling this way, then what we would recommend is that you take the legs up the wall. So if you've got a free wall handy, Leo's just going to demonstrate this. Then you can take the legs up the wall, soften the abdomen. You can also use the belt so that you can encourage the legs off the wall. Yes, and then take them back to the wall. This is all about creating access. And when the legs can work well, there's a little bit more length in the front hip flexors, then the back will start to recover and become more supported. Okay, so we're going to finish with this pose now. So when you finish your practice, you bend your knees into your chest and you just roll to your right side. We're going to move on to Malasana action. This is just a preparational stage of Malasana. It's not the classic pose how we regularly practice it. It is with the legs a little apart, with the heels up onto a support. Yes, so you can see here that the heels are up onto a support, and then you come into this squatting position. Now, some of you will find it really difficult to stabilise those heels down. You might not even be able to hit the heels onto the folded blanket here, so therefore you need to have a slightly higher support behind you. Maybe a couple of bricks, yoga bricks, if you've got them handy, or a couple of books which are the same size. We see here for Leo, she can use her upper arms against her frontal shins here, which actually increases the abdominal action. With this, go deep inside. You have to draw the abdomen towards the spine side so that you broaden the space, the skin fibre across the lower back. This is a very, very important pose for any restrictions in your lower back. Just take it easy, take it slowly, step by step. For those of you who find it really challenging, and it's difficult, and we have students in the centre who come to class who find it very difficult to take the arms in front of these shins like this, then you can place your hands either a little higher, or as you can see, Leo is coming to an imaginary chair. So we haven't got the chair ready here. So just put your hands either to a chair, or if you've got a ledge or something like that to put your hands onto, then be in this position and draw the abdomen back to the spine. It's all about that connection that's so important. And then when you come out of the pose, you just release down and straighten the legs, you can see here. If you find going into the malasana action from a standing position, or in that forward bending action, as a lot of people find it difficult to actually take their hands down in that way, then you can step back onto the support in this way. And that also is a good thing to do. So remember these two poses so far, and then we come to a supine action, Vajrasana, which is again about softening the abdomen and taking it towards the inner face of the spine. So you can see here with Leo, she's just lying down. What was very important about how she went into this supine action is that she lifted the lower back and lengthened the tailbone. If you've got any restriction, then you need to encourage this action to happen. And then taking the thighs together and bringing the legs in towards the abdomen. And what will restrict this action is if you're really tight in the front hip flexors here. So you have to see that you soften there, and you even taking the thumbs into the frontal thigh creases is quite helpful to get that action. And then finally holding on to your shins. And remember, if you're suffering from chronic or acute pain, then it's worth getting advice from your physio or your doctor to see what's possible with your exercises. So just be in this pose for a few moments, letting the abdomen completely release towards the spine, and practice these 3 poses to maintain, recover and repair. Remembering that once you're back up and running and able to carry out all your daily tasks, make sure you get to your yoga class. Wouldn't you agree, Leo?
Absolutely. So the 3 R's for us are not reading, writing and arithmetic. They are what are they? They are relief. They're relief, they're repair and they're recover. Alright, so that's what we're looking for when students come into our classes. If they've got a problem, we're looking to help get them out of their problem and get them back on track so that they can do a regular yoga practice and maintain health throughout the body.
Yes, and remember, it is all down to you. You have a responsibility to look after your back. So use the tools and get up and going.
Alright, so thank you for joining us today, and we look forward to seeing you again soon. Namaste.
Namaste.